Fracture healing. Published by WordPress.com. Fracture healing. I. Perrin strain theory. Definition. Strain is the change in tissue length relative to the original length in response to force. Tissue formation by strain levels. Less than 2%, bone formation. 2 to 10%, cartilage formation. Greater than 10%, fibrous tissue formation. E. Types of fracture healing. 1. Primary healing, strain less than 2%. Achieved through absolute stability, direct bone healing, no callus formation. Example, Haversian remodeling, e.g., compression plates. 2. Secondary healing, strain 2 to 10%. Achieved through relative stability, in direct bone healing, callus formation occurs. Examples, non-rigid fixation, e.g., cast, external fixator, bridging plate. Semi-rigid fixation, e.g., locked plates. Combined methods, e.g., intramedullary nails. 3. Stages of fracture healing. 1. Inflammatory phase, 3 weeks. Events. Hematoma formation from bleeding, periosteum, cortex, medulla, and soft tissues. Inflammatory response involving neutrophils, macrophages, and platelets. Cytokines produced, PDGF, TGF-beta, IL-1, Illinois-6, TNF-alpha, and PGE. Outcome. Recruitment of progenitor cells, fibroblasts, and mesenchymal cells, formation of granulation tissue. 2. Reparative phase, 3 months. Events. Neovascularization via vasoactive substances, e.g., NO. Indifferentiated mesenchymal cells, UMCs, migrate to the fracture site and differentiate into cartilage, bone, or fibrous tissue based on biomechanical stability. Callus formation. Soft callus, organized hematoma. Hard callus, woven bone from endochondral ossification of soft callus. Types of callus. External, bridging, endochondral ossification of soft callus. Periosteal, appositional growth from periosteum. Internal, medullary, slowest formation. And 3. Remodeling phase, till 3 years. Bone dynamics. New bone is laid along lines of stress. Bone is removed from areas without stress. Result. Formation of mature lamellar bone with alignment to mechanical stresses. IV. Bone remodeling. Definition. Continuous resorption and formation of bone to replace compromised bone and sculpt it into normal shape. Laws governing remodeling. Wolff's Law. Bone remodels according to mechanical stress. Compression side negative piezoelectric charges increased osteoblastic activity. Tension side positive charges increased osteoclastic activity. Heater-Volkmann law. Compression across physes slower growth. Tension across physes accelerated growth. Remodeling unit. Osteoclastic tunneling, cutting cone, consists of osteoclasts at the head, capillaries in the middle, osteoblasts forming osteoid at the tail. Cycle duration. 4 to 6 months. Versus factors affecting fracture healing. 1. Systemic factors. Age, activity level, nutrition, calcium, vitamin D, protein, vitamin C. Diseases, e.g., diabetes, chronic renal failure, anemia. Hormones, e.g., growth hormone, androgens, calcitonin, PTH. Smoking and medications, e.g., bisphosphonates, corticosteroids, NSAIDs. 2. Local factors. Fracture pattern and bone type. Bone quality and vascularity. Soft tissue injury and interposition. Implants used and immobilization. Venous stasis and infection. V. Enhancement of fracture healing. 1. Ultrasound, LIPUS. Low-intensity pulsed ultrasound. Increases vascularity and accelerates healing. 2. Electrical stimulation. Direct current. Enhances inflammatory response. Alternating current. Promotes reparative phase. Pulsed electromagnetic field, PEM. Aids remodeling and calcification. 3. Bone morphogenic proteins, BMPs. Osteoinductive factors from the TGF-beta family, e.g., BMP2, BMP7. Clinical application. Used in spine fusion and fracture healing. Contraindications: pregnancy, infection, tumors, skeletal immaturity, and bovine collagen allergy. 4. Growth factors. Examples: FGF, PDGF, IGF-1, IGF-2. Functions: enhance proliferation and differentiation of osteoblasts and chondrocytes. 5. Stem cells. Injection into fracture site to proliferation, sources fat or embryonic or bone marrow surrogate. And 6. Hydroxyapatite. Used to coat implants for bone ingrowth.